following is information I want you to be aware of regarding the medication administration component of your skills test. Remember, you have 10 minutes to give one countable medication to one individual. You will not be administering a liquid medication. The med is a tablet, it's countable, in blister packaging, and may or may not have a C stamped on the package. Please be aware the medication in the blister pack may have been popped out of sequence by previous candidates. If so, you will see a sticker on the package calling your attention to this. This means you must count each tablet separately and cannot rely on the numbered blisters. This is not an attempt to trick you. The tester will read a set of instructions. The instructions include being asked if you want to be informed when 5 minutes remain, or if you want to complete the process uninterrupted. After those instructions are read is when your 10 minutes begin. At the end of the instructions, the tester will ask you if you have any questions, as once the test begins, they're not allowed to answer questions. At this point, you may ask for a small piece of paper to write notes on. The paper will be collected at the end of the test. The tester will assume you've washed your hands before and after the process. If you forget to mention that you've done so, you do not fail. Verbalize when comparing the 5 rights during the 3 cross-checks. Remember, document in both the medication book and the count book. If you forget to sign the bottom of the med sheet, you do not fail. However, if you initial the med sheet before administering the medication, you will. The remainder of this presentation is a demonstration of the medication administration process.
Welcome to your medication administration test. Please follow along with me while I read the instructions. I will be observing and recording what I see you demonstrate. D&S Diversified Technology staff in Findlay, Ohio will officially score your test. I do not decide whether you have passed or failed. This is the medication administration portion of the skills test. You are being asked to administer a medication to an individual according to the scenario which I will read to you. Listen carefully. You will also be given a copy of the scenario for reference. The medication you are administering is a countable substance. Following the instructions on the scenario, you are to administer the proper medication to the individual and document the administration using the appropriate medication sheet and controlled substance count sheet. While you are administering the medication, in order for me to know if you have completed each of the 3 checks for the 5 rights, you are expected to clearly demonstrate to me that you are performing the checks. If it is not clear to me, you will not be credited with completing the checks. You will have 10 minutes to complete this task. Would you like to know when you have 5 minutes remaining?
No.
Here is your medication book. In the medication book, each individual has a designated area, and in that area you will find the healthcare provider order, the medication administration sheet, and the medication information sheets. This is the medication box. Here you will find the medications for each individual. Each individual has their own drawer. Here we have the supplies that you need to give your medication, and this is the controlled countable substance book that you will use. Today is September 3rd, 2012. Please administer Bylee's 8 p.m. medication on September 3rd, 2012. Document the administration on the medication administration sheet and complete the medication count record. It would be helpful if you verbalize each of the 5 rights as you demonstrate the 3 checks. You need to tell me when you are finished. I cannot answer any questions once we begin the test. Do you have any questions at this time?
No, I don't.
Okay. You may begin when you're ready.
Okay, I'm going to start my med pass. I have all of my supplies, I've washed my hands, and I'm going to unlock my med cabinet. According to my scenario, I'm going to give Viley his medications on September 3rd at 8 p.m. In order to figure out which medication I'm going to give, I need to open my med book. I locate Viley, and I can see that on September 3rd at 8 p.m. Viley is going to receive Klonopin. So now I locate Viley's med box. And I locate the correct medication. I have the Klonopin. Now I'm going to locate the medication page in the controlled substance book. I do this by first turning to the index. I can see that Viley's Klonopin is on page 2. So I have the correct page open, and I'm ready to start check number 1. Check number 1 is between my healthcare provider order and my pharmacy label. I have Viley, Klonopin 1 milligram by mouth 2 times daily. Viley, Klonopin 0.5 milligrams, take 2 tablets by mouth 2 times a day. I've completed check 1. I'm now going to start check 2 between my pharmacy label and my med sheet. Viley, Klonopin 0.5 milligrams, take 2 tablets by mouth 2 times a day. My med sheet, Viley, Klonopin 0.5 milligrams is my strength. My dose is 1 milligram. The amount is 2 tablets by mouth twice a day. I'm going to give the 8 p.m. dose on September 3rd. I've completed check number 2, which means I can now prepare my medication into the cup. And make sure I have the 2 tabs. I'm now going to start check number 3. Viley, Klonopin 0.5 milligrams, take 2 tablets by mouth 2 times a day. My med sheet, Viley, Klonopin 0.5 milligrams. My dose is 1 milligram. The amount is 2 tablets by mouth twice a day. I've completed 3 checks. I can now administer the medication. Here you go, Viley. Here's some water for you. I make sure I observe for a swallow, and then I'm going to do my look again. I can now document the medication administration. I do this by putting my initials in the corresponding date and time box, and then I sign the bottom for the signature list. I now come to the count book. It's September 3rd of YR or 12. The time is 8 p.m. The route was by mouth. I had 24 on hand. I administered 2 tabs. I write out the word 2. And my amount left is 22. I sign my full name. And I'm done with the documenting. I now need to secure my medication. And I make sure that I lock the cabinet. I am going to wash my hands, and I always make sure I continue to observe for the effects of a medication. And I've completed my MedPass.
You have just watched a demonstration of the medication administration process. Please use this DVD to practice over and over prior to your skills test dates.